the doctor's office for probably the umpteenth time, glancing at the same old pictures that you've seen 1,000 times before, rereading the doctor's awards and certificate placed ever so neatly on the wall. Despite the fact that you know what the doctor's about to say, the suspense is killing you. You are going to die. There are so many people out there with fatal diseases that the end of the line is imminent. Patients suffer, families suffer, and even the doctors suffer. The debate over physician-assisted suicide or physician-assisted death, or PAD, is part of the process improving care for dying patients and their families. Doctors have a responsibility to address the suffering that persists despite their best efforts. What if their best efforts aren't enough? What if there's no solution and the only thing that is going to happen is this patient is going to endure excruciating physical pain and suffer severe psychological damage? Who wants to experience that in the last days of their life? Patients enduring pain and depression with terminal diseases should have the right to physician-assisted suicide to ease the already intolerable dying process. According to an article in Human Rights Magazine written by Kathy Liu, a set of doctors were finding it so painful for themselves to tell their patients that not only they were dying from a terminal disease, but they were going to have to let the disease take its course despite the physical pain and suffering. If a person can refuse the right to life-sustaining medical treatment, then why can't they have the right to PAD? To go with no pain, no suffering, and just a tad bit of dignity. This is a very complex and controversial issue, and the Supreme Court ruled that there is no constitutional right to committing suicide. The Supreme Court left the door open for future deliberation and left most of this decision in the hands of state governments. Euthanasia is illegal in all states of America. What is the difference between euthanasia and physician-assisted death, or PAD? The difference is who administers the lethal dose of medicine. With PAD, the doctor does all the preparation as far as sanitizing the instruments, making sure that the patient is in the proper environment, and make sure that the right amount of medicine is administered to make that person sleep forever. After the IV is administered, the doctor then takes the syringe, puts it in the patient's hand, and at the patient's own pace or readiness, they administer the drug into their IV. Euthanasia is when a doctor or some sort of third party administers the drug into the patient's IV. As mentioned before, euthanasia is illegal in all states of America, but according to an article in Wikipedia on euthanasia and PAD, PAD is legal in the states of Washington, Oregon, and Montana. When a patient is sick, they have the right to refuse dialysis, chemotherapy, and even life support. If they decide to continue with life support and then change their mind because they don't want to have to endure the pain and suffering, they sometimes no longer have the right to pull the plug. Some feel that physicians are not trained when they go to medical school to handle a situation like discussing physician-assisted suicide. They are incompetent, uneducated, and inexperienced, and some will debate that they are also dishonest. I think with the right documentation and consent and brief therapy with the patient and their family, they should have the right to choose whether they live or die. Whether death engulfs them while enduring pain, misery, and the thought of being a burden to their family, there is, I think, some dignity left for someone in this situation and even closure for the family. I think spiritual or religious people will feel the same about PAD as they do abortion. I think many people will fluctuate as far as what is right and what is humane when it comes to PAD. According to a religious article on modern Christian views on suicide, most Christians oppose euthanasia or PAD based on the belief that life is given by God and that no one should interfere with the natural process of death. Catholics, on the other hand, strongly oppose a physician-assisted suicide. If we can give medicine to help cure a disease, that is interfering with the natural cause of sickness or death. Think about it from a religious standpoint. If someone is sick, that was God's path for that person. If we administer testing, medicine, and diagnosis to treat this illness or sickness, isn't that interfering with God's plan too? Well, this is from kind of an opposite standpoint. Someone is suffering, their family is suffering. They sit and pray for a quick and painless death. However, the suffering is beyond any doctor's relief. Why not relieve this person and their family and make the suffering stop if they choose to? To me, it's the same thing. Whether or not you are for or against this action, keep in mind the suffering and their families. If you have lost a loved one or know someone who has lost a loved one from a fatal disease, then you know how serious this is for the person and their family. I would think that every human on earth would have compassion for the people who are suffering from deadly diseases and intolerable pain with their family in a detrimental state as well. After hearing what I have to say, I would hope that you could form your own decision on physician-assisted suicide for the people enduring agonizing pain and their families already grieving for them. Let us try to relieve some of the stress by giving them the right to a good death. I think the right to a good death should be a basic human right and freedom. I mean, whose life is it anyway?